welcome everyone to Oscar Care Group's Ask a Speechie webinar. My name is Michaela and I'm a speech pathologist at Oscar Care Group.
Hi everyone, I'm Sabrina and I'm also a speech pathologist here at Oscar Care Group. Thank you for sending your questions. We're going to get started, so let's jump in. So our first question we have is, how can I identify and differentiate between typical language development and potential speech or language disorders in young children?
So this is a really big question. We say it's always good to refer back to the communication milestones. These milestones provide us a lot of information about the typical development of a child's communication skills. It might be the words that they understand, gestures that they use to communicate, sounds that they make, and even just how they play and interact with others. These milestones are really useful information because they provide individuals with a guide on how their communication skills are developing as per their age. It also provides really great information for parents and for any carers if they're unsure if a child's communication development is unusual or typical.
So the Speech Pathology Australia has a great resource online about the communication milestones. When the recording is sent out, we'll include it in the links. But another thing you can do is also talk to your GP or your paediatrician, child or maternal nurse, kinder or carer, or even school teachers about your child's speech or language, just for a second opinion or possible referral to a speech pathologist. So our next question is, there's two questions actually, which are quite similar. Are there any red flags or warning signs I should be aware of when it comes to speech and language development in young children? And what are some signs that a child is speech delayed in the early years of age groups?
Okay, so some red flags are as follows. There are a lot, and again, we like to refer back to those communication milestones that we mentioned earlier, but these are a few things that we've pulled from them. So they might have limited to no speech by 12 to 15 months. You would typically be expecting a child to say a few words or sounds by that age. Again, not speaking at all might also be a concern. Unclear speech, that's quite difficult to understand, is another red flag. By 3 years of age, most children should be able to be understood by familiar adults like their parents and carers most of the time. Another red flag, lack of progress. This could be just not showing any improvement or progress in their speech or language over time. They may also have difficulties following instructions. So by age 2, children can typically follow simple instructions.
Some more general developmental concerns may be difficulties with pragmatics, for example, social interactions, limited use of eye contact or eye gaze, difficulties with turn taking, both in play and in conversation. Another one is regression. So if a child loses previously acquired speech or language skills, this could indicate developmental concerns neurologically, and this should be assessed. And another one is hearing issues. So any difficulties with hearing or recurring ear infections can impact on hearing, speech, and language, which can affect the child's development. It is also important to note that for those who are neurodiverse, their communication styles and development may differ to those who are neurotypically developing.
Great. Our next question is, I am seeking advice regarding my 2-year and 8-month-old son's speech development. He speaks in single words or short phrases like see you later, recognizes letters and numbers, follows instructions, and communicates his needs with 1 or 2 words, but he does not form full sentences. He started childcare in February 2024. Is his speech development within the normal range for his age? So pass this on to Sabrina.
So based on those communication milestones previously mentioned, at about 2 years of age, children should usually be able to follow simple 2-part instructions. For example, give me the bowl and the car. They should be able to say more than 50 words and put 2 words together. And by 3 years of age, children can follow more complex 2-part instructions. For example, give me the teddy and throw the ball. They should also be able to say 4 to 5 words in a sentence and say approximately 1,000 words. It's difficult for us to say whether their speech and language is typically developing without assessing and seeing them individually, but these are some of the communication milestones for these age groups. It's also good to refer to these communication milestones mentioned earlier. And if you suspect that they are not meeting these milestones, it's best to get an assessment and see a speech pathologist. So our next question is, what are some ways to support children with their language development?
I'll tackle this one. So early language development is typically learned through interaction with others and their environment. The parents and guardians play a really critical role in the development of their little one's language because they're the people that they're around the most. A few things that you could do just in your normal routines and your daily structures: repetition. So repetition is the key, as a child must hear a word 4 to 12 times before it sinks in different contexts, and then they can add it to their vocabulary. Talk to your children as you're playing, while they're setting up activities, while you're cleaning up and feeding them, and tell them what you're doing as you perform each action. You can point out colors, shapes, and descriptors of objects while playing. Try to expand on what the child says. So for example, if your child says, horse up, you could say, the horse goes up, or the brown horse goes up, and try and expand on what you're saying to expand their vocabulary and their sentence structures. You can repeat what the child says to show that you've understood. For example, if a child says to you, up, you could say, you want to go up? You can ask questions with a choice to encourage them to speak, such as, do you want the green one or the red one? You can acknowledge when a child tells you something and show that you understand what they're saying. This motivates them to keep talking. You can pause after speaking to allow the child to think about their response and again encourage them to speak back to you. And of course, look into seeing a speech pathologist. They'll be able to work with your child's strengths, and they can provide you with some in-depth training tailored to you and your child. Next question. Children who are from bilingual families do take some time to communicate. Should we be worried if they only use one language? Sometimes they only use gestures instead of words, but they understand what you say.
Yep. So typically with bilingual children, they will favor one language, and that's completely okay. They may need more exposure to the language, or perhaps they just find it easier to communicate in their chosen language. You can try repeating what the child has said in the minority language, so the language that you speak less of, but you don't have to force your child to speak it, as it might discourage them from communicating and make them not really want to talk as much. And as for gestures instead of words, it's difficult for us to comment on this without seeing and assessing the child and seeing the extent of how many gestures they may use or how little they may use their words. And having good receptive language is also, or understanding language, is a good sign that they will pick up on the language that they're speaking in and continue. And it's good to continue to expose them to both languages, because we know that language exposure is how children learn.
Great.
And so our next question, I'd like my son to learn how to roll their R's, as we have an Italian background. So far, I've had no luck. He just turned 5 at the end of June.
Okay, so we look at the English R, which is quite different to the rolled R, but we'll try our best to speak on it as much as we can. So the English R is usually the very last letter that children learn to make. It's usually perfected by the age of 6 or 7 years. So it probably isn't too problematic that he hasn't quite mastered it, considering he's just turned 5. You could try modeling that rolled R sound for him and have him imitate you, but it may not be the most interesting thing. So you could try and make it into a game and tell him, let's try to do the quickest or the loudest rolled R. If he's still having trouble, you could try looking at his tongue placement. So when we say the letter D, our tongue placement is in a similar place to where you make that rolled R sound. You can try explaining this to him and showing him with the mirror, show him where that tongue is placed at the top of the mouth.
And following on from that, when rolling the R sound, it normally involves the tip of our tongue to vibrate against the roof of our mouth, closer to the front of our teeth and kind of coordinating that airflow. As rolled R's are not really a characteristic of mainstream Australian English, which is what we speak, your son may require more exposure and direct instruction on how to roll his R's. And especially at 5 years of age, children are typically learning to master all their sounds, especially in kind of the Australian English sounds. So rolling the R sound may require some more time and practice. Definitely. Yeah. So our next question is, what if a child has picked up an accent or lisp from relatives or friends? What techniques are useful to correct the incorrect pronunciation other than constant reminders?
Okay, I'll speak a little bit about the accent. You can try increasing exposure to the accent that you're wanting the child to learn. You may need to see a speech pathologist to correct any incorrect sound pronunciations. It is quite difficult to provide specific strategies for this since we're not sure of those particular sounds that are not being correctly produced, and each sound has its own different strategy. It also really depends on the age of the child. Children are sponges, especially when they're quite young, around 3 to 4 years. So it can happen quite a lot where accents come and go. If the child is above 8 or 9, they might require speech pathology intervention. But the very first step in correcting any incorrect sound productions is to actually hear that difference between the right production and the wrong one first, and be able to discriminate between the two. So you could try say the same word in each accent and aim for the child to pick the correct one and train those ears.
Yeah. So just a little bit more about accents. It's important to note that accents are a normal variation of speech and are pretty important in an individual's cultural and linguistic identity. So not all accents necessarily mean there's a problem or speech communication issue. If your child is affected, if your child is having difficulty being understood by others, it's affecting their self-esteem, their confidence to communicate, affecting education development, then this kind of means or may suggest that a speech pathologist might be required to intervene. And as for lisps, this is mostly what speech pathologists work on. So it might indicate that there's specific speech sound difficulties, particularly with the s, z, and sounds. Lisps typically indicate difficulties with tongue positioning and specifically with producing the s and the z sounds. It's typical for children to experience a phase where they have difficulties with these sounds. And it's kind of just about the children developing their understanding of where to place their tongue in relation to their teeth and their lips and producing those sounds. And these types of lisps, they typically occur at around 4.5 years of age. And if you kind of start to see that these speech sounds persist, I recommend that you seek some assistance from a speech pathologist to work specifically on correctly producing those sounds. And so our next question is how to assist a child who has some difficulty in articulating some of the sounds of letters, such as the l and n, which can be difficult to understand.
Again, a very tricky question to answer because we do really need to assess the speech errors of the child. We need to determine, are they unable to say the sound at all? Are they substituting it with another sound? For example, are they saying W instead of L? Does it sound distorted? Does it sound prolonged? We need to have a look at this and then we can determine how we best treat it. So we have different methods for treating each of these reasons. So it is really important to consult a speech pathologist to assist with these. However, I will say that the L sound is a really tricky sound to make. It's usually acquired at age 5, so if your child is younger than this, it's not to be worried about.
And our next question is, when is the best time for intervention? Our daughter has a large vocabulary but has some clarity of speech issues. It's progressively getting better, but we want to know if she would benefit from intervention, or what can we do at home to assist her? She's 4 years old.
Okay, so by 4 years of age, there are many different sounds that a child should be able to pronounce. These are the H sounds, W, P, B, T, D, the sounds at the back of the mouth, the K and G, and G sounds, F, Y, S, Z, Ch, J, and Sh, many sounds. So if your daughter is having trouble with any of those sounds, she should have definitely mastered them by the age of 4, so it's a really good idea to get some speech pathology intervention.
Yep. So as Michaela said, with speech pathology intervention, it's quite important. And if your child sees a speech pathologist, we can do assessment on not only just speech sounds, but also her language. So her talking, her speaking, and her ability to understand language, and assess for any other concerns. It's also important to note that children develop their speech sounds. It's important for children to develop their speech sounds because there's quite a strong connection between speech sound awareness and literacy skills. So especially if she's going to school next year or the year after, it's quite important. So our next question is stuttering normal in 3-year-olds? Only just started 3 weeks ago, but is starting to happen with most words and sentences. Should I be worried, or is this a phase?
Okay, it could definitely be a phase, or you should be worried. You just have to check a few things. There are lots of things to consider. We always recommend seeing a speech pathologist to assess this no matter what, but we can give you a few tips and tricks. It is really common at this age to stutter, and it's called developmental stuttering, and this is where there is so much new language happening and the child's brain is working quicker than their mouth, and it can result in some stuttering. It could also be possible that the stuttering is here to stay. So some warning signs that might indicate that the stuttering is here to stay is a family history of stuttering. If the stuttering has been happening for 6 months or longer, if the stuttering is quite severe and the child's struggling to get the words out and they feel blocked at times, if the child's getting really frustrated with the stuttering that they can't get their message across, if there's facial grimacing while stuttering, or any sound prolongations.
Yep, so if it's affecting the child's ability to communicate and be understood, causing the child frustration and affecting their self-confidence when communicating or speaking, it's pretty recommended and good to see a speech pathologist to help with that.
Always see a speech pathologist just in case.
Yeah. So our next question is, should we frown upon dummies as a deterrent to good speech and language development?
Okay, so the research around this is quite conflicting. Some studies suggest that there's no link between speech problems and dummy use, whereas others suggest that prolonged use of a dummy can affect certain speech sounds. At the moment, there's no strong evidence to suggest that it can lead to problems, so it's difficult to comment on, and we're waiting for more research. But I will say that too much of anything is never a good thing. If there's prolonged use of it, there is potential for sounds to not be developed properly just because the teeth and palate may be changing their structure. And there's also less desire for the child to communicate if they've got something in their mouth at all times.
So our next question is there an impact on babies or toddler speech development from using food pouches, so sucking instead of opening their mouths for a spoon?
So food pouches can be really convenient for those busy times, but only using food pouches could really limit learning and developmental opportunities for these children. Touching, chewing, and eating food plays a vital role in their oral and motor skill development. So although it can be more messy, it is really important to allow babies to learn to self-feed and explore their food using fingers and spoons.
Yeah, so it's really important for babies and toddlers to try lots of foods that vary in shape, size, color, taste. And it's also important for the children to experiment, like Michaela said. So using their hands, using cutlery, biting, sucking, taking food from the spoon. As babies and toddlers develop, their oral structures change. So, for example, less baby fat in their cheeks, so less sucking movements when they're feeding and starting to chew. And so continual use of food pouches may limit these opportunities to develop those feeding skills and might promote sucking movements when they're eating. It's also important for babies or toddlers or children to develop coordinating those movements of the mouth and moving food inside the mouth, chewing and swallowing, as it's quite an important skill to have as they start to have different textures of foods. But if you're concerned about this, I think it's important that you consult with your GP or your pediatrician, child or maternal nurse, or a speech pathologist who specializes in pediatric feeding, just so they can check everything.
Great. So I think this is our last question. How early is too early to start working with a speech pathologist?
Great question. So it's never too early to start early intervention. If your child isn't meeting their communication milestones, you can immediately start working with a speech pathologist. So usually we engage in play-based therapy or take a play-based approach to early intervention and work with parents or carers or anyone looking after the child to educate them and provide strategies on how to support and assist your child at home with their speech and language. So play-based therapy involves play where speech pathologists like Michaela and I model language, teach vocabulary, support children to engage in conversation, and coach any parents or carers to model language and speech and provide the most opportunities for children to develop their skills at home. So it's also good for children to get assessed by speech pathologists, particularly if there's any concerns to potentially detect any speech or language disorders if that may be present. But yeah.
Great. So that's the end of our questions for today. If you are looking to see a speech pathologist, we do have a wonderful clinic in Mount Waverley where Sabrina and I are available to help one-on-one for a range of reasons, including stroke, dementia, brain injuries, any speech or language concerns, swallowing, any social communication skills. And our team is here to help everyone of all ages. And we can also conduct telehealth appointments if you're unable to come to us. We do have a wait list, but you're more than welcome to join the waiting list and we can be in contact with you once an appointment becomes available.
So that brings us to the end of our presentation. Thank you very much for submitting your questions and joining us today. The recording of this webinar will be sent to you all via email and the links will be attached as well. Hope you all have a lovely day. We'll see you later.
Thank you.
Bye.